Well, it is called CyberKnife. It is a cutting-edge $3 million system that targets cancer and non-cancerous conditions. It generates a radiation beam attached to a highly maneuverable robotic arm. And we've got Dr. John Bedewick. He is an oncologist and the medical director of St. Louis CyberKnife. And he joins us with one of his prostate cancer patients, that is Jeffrey Bozier.
Right.
Thank you so much for joining me. And you were treated by the CyberKnife.
I certainly was,
You
yes.
seem to be doing okay.
Oh, no problem at all, yes. It was amazing.
Doctor, how long ago was this?
About a year.
1 year.
A year this month.
So you had this CyberKnife for some time.
I think we've had it since 2009, actually.
Oh my goodness,
Yes.
so you've conducted quite a few prostate cancers.
We've done about 200, I think, prostate cancers.
Yeah, and that's your specialty, and of course this is used for other types of cancers as
Yes,
well. Did you have, Mr. Bozier, did you have any kind of ill effects or any pain?
Nothing at all. Nothing at all. I never felt anything during the procedure. Nothing. I just lay there and I could hear the motors of the robot moving, and that was it. Nothing at all.
Doctor, explain how it works. Now, you went in, I think, a week before, and you put in some like gold flecks.
We put in gold markers. The way the CyberKnife works is it sees these gold markers, and each treatment consists of literally 100 to 200 beams that they come in
All
from
around.
multiple directions, and this creates a high dose volume that literally shrink wraps to the tumor, or in his case, the prostate. And it sort of mimics the dose distribution of the radioactive seed implant, which is a well-tested, very robust treatment for prostate cancer. We don't have quite as long follow-up for the CyberKnife as we do for the radioactive seed implant, but it looks as though it should be just as good.
Now, with the other forms of surgery before the CyberKnife, you would have had to make quite a few visits to the doctor, correct?
From what I had read, yes.
You had like 45 visits.
45, yeah.
Yeah.
I did it in 5 sessions.
5 sessions?
Yes.
Wow, and insurance takes care of this?
Yes, it does.
It really does.
There are some insurance companies that will, we'd have to do a peer-to-peer. It's not completely approved by all insurance companies, but more and more are. As the data get more mature, I think it's becoming more accepted.
And no side effects?
There are side effects, and Mr. Bozier was very lucky. He experienced none, but some patients will experience burning on urination, increased frequency of bowel movements, difficulty urinating, and those usually last for about 2 weeks after the end of the CyberKnife.
And other doctors are using this on tumors, benign as well, and all kinds of different cancers?
It was initially designed to treat tumors in the brain, close to the optic nerve or the brain stem, where it's very important that the high-dose volume can be contained, so you can treat tumors, and I guess that's why they use the word knife. It's almost as though the knife is cutting, because the dose distribution, the high-dose volume falls off so rapidly, you can spare nearby normal structures.
All right, well, you sold me on it. I hope I don't need it, but congratulations. You look to be doing very well. Doctor, thank you so much for coming in. St. Louis CyberKnife, and you're located?
At St. Clair Hospital in Fenton, Missouri.
There you go. All right, we're going to take a little break on that. Some cutting-edge technology. We'll be right back.